I've gotten really into Zoom, you guys. Okay, so it's been about a week since the last video update I've posted with information about what's been going on. I know that now we're switching to the module-based learning in class, but I still wanted to give a little bit of an update on kind of the state of events to tie some things together that you may or may not have heard about for you or for anybody else who happens to see this video. And besides the fact that Zoom lets me teleport to a land of wonder, um, this is going to make it a lot easier for me to share some figures that I'm going to show on the screen. So one of the first things I want to address is one of the common misconceptions that is still going around, and that's, it's just a flu, bruh. It's just a prank. It's just a prank, bruh. It's not just a flu. I mean, besides the fact that literally it is not a flu, that influenza is a completely different virus compared to the coronaviruses with different mechanisms of action in the body, even though they result in some similar symptoms. What I really care about are the larger patterns for public health that we're seeing that are different between coronavirus and influenzas, including even previous of the more deadly influenzas like H1N1 and other ones you may have heard about. And all of these sources I'm going to link in the comments of the video below. I'm not going to do the like embedding thing because I don't really understand that. The first thing to note, as we see here in this figure, is the overall fatality rate is, while COVID is more similar to the flu than other coronaviruses we've seen, it's still a significant jump in average deaths. And obviously those deaths are not evenly distributed across age groups. It seems to be a little bit more shifted towards the older demographics, but it's still concerning. So on average, what we've seen with seasonal flu is a death rate of about 0.1%. Right now, on average, we're tracking about from the high ones to 3.4% death rates for coronavirus. Escalate that up to millions of people in a population, and that starts to get a little concerning. But it is still better, admittedly, than other coronaviruses like SARS or MERS, Middle Eastern respiratory virus, respiratory syndrome. These ones and their high fatality rate are one of the reasons why many East Asian and Southeast Asian countries have been responding so well to COVID-19, because they learned their lesson with these previous viruses and the heavy toll that they took, and they developed protocols that they're enacting now to help constrain the spread of the virus. Unfortunately, many of us in the European and North American countries haven't seen a major pandemic since 1918, so we're having to relearn and readapt a lot of those strategies. As well as the possible higher risk of fatality, one of the concerns is that COVID-19 spreads much faster. There's something called the R0 value that is an average of how many people an infected person can infect, which for flus is usually about 1 to 2 people, so it calculates out to 1.3. That's largely because it has a shorter incubation time. So when you get sick, you figure that out right away, and then you're going to either be in the hospital or be home self-isolated from people. With COVID-19, that R0 value is much higher, between 2 to 2.5, largely because the virus seems to be able to spread much more easily on breath and droplets. It lasts for quite a while on surfaces, on average 3 days, but possibly up to 17, some sources say. But most importantly is the incubation time is so long. It's on somewhere between 1 to 14 days. It seems to vary from person to person, but that means that for 14 days, somebody could be walking around, spreading it around and not even realizing it. So last time I talked a little bit about this high risk of spreading in terms of why we were enacting social distancing, and hopefully it is something that you have been doing. But the question now is it working? It has only been a week for at least most of the Bay Areas, and a little bit less than that for California in general. So it's kind of hard to tell because, again, the incubation time for this disease is a good 2 weeks long. But there are some early figures coming out that indicate that it might actually possibly be working. So this is a chart that was put out by the website Swell just a couple days ago that takes some of the early data, comparing and contrasting California with New York, since those seem to be, besides Washington, the major hotbeds of activity right now for the virus. and specifically comparing the Bay Area to New York, since these are both large urban settings that have taken kind of different strategies. The Bay Area enacted lockdown much earlier than New York and to a much higher degree of severity than almost anywhere else in the country. And so far, what this seems to be showing is an interesting pattern. So blue is the Bay Area total cases going back to March 15th, and New York is the total cases going back to the same period of time. Now, obviously, this data isn't great because there's a lot of confounding variables involved. First off, we know that New York is doing a lot more testing. So if you're doing more testing, you're going to have a higher number of cases overall. Additionally, there are some demographic differences between New York and Bay Area in terms of which countries we tend to get a lot of direct contact with, how we, transit around our lives. New Yorkers tend to do a lot more public transit than we do here. So all of those are certainly messing up the data or confounding the data a little bit, but it's still an interesting trend to see. But more interesting, especially when it comes to testing numbers, is looking at number of deaths. Because quite frankly, deaths don't lie. I mean, famously, death doesn't lie. So the number of deaths that we've seen in these two regions across the same period of time are showing markedly different trends, that the New York cases are beginning to show the classic pattern of that exponential curve that I keep talking about, whereas the Bay Area cases, which go all the way back to the 15th, where we started to really severely enact social lockdown programs, are showing a much lower curve. Another interesting graph that was just released a couple days ago, though, shows a much more compelling story comparing one region that enacted social distancing programs early and another region that did not. So this is a graph that was put out by a woman named Stephanie Jolly, a graduate student, and she just on her own decided to look at some data and compared and contrast the case numbers between Kentucky and Tennessee. Now, this is really interesting because these are both states that are, first off, right next to each other. So they have similar transit coming in and out. They also tend to share fairly similar demographics, similar population sizes. So they're a much better point of comparison than the Bay Area and New York. But what we see here is the same sort of pattern, that Kentucky declared states of emergency and started enacting social distancing procedures much sooner than Tennessee, and that seems to be reflected in the numbers that we've seen since then. So in here, Kentucky is in the blue and Tennessee is in the orange, and the boxes, I don't know if it's easy for you to see. I can zoom in, there we go. Better. The boxes enact a specific timeline of events where Kentucky declared a state of emergency on March 6th and encouraged social distancing on the 7th. Schools started to be closed around March 11th, and everything was taken more seriously from then. By contrast, Tennessee did not advise schools to close until March 20th, and at this point, I don't know what social distancing protocols they have enacted. But here we see a similar trend, that Kentucky, that declared social distancing earlier, has a lower curve than Tennessee, that enacted it even just a few days to a week later. And what I really like about this graph is that she also takes into account the number of people that are being tested. So these dark bars show the ones who tested positive, but the faded bar shows the number who were tested overall. And so what we can see is that even though Kentucky is testing more people, and so they have a higher number of people that they're pulling in to test for the virus, they have much lower case numbers than Tennessee, who is testing fewer people, but they're the ones that they're testing more, a higher percentage of them are coming up positive for COVID-19 than not. Now, while slowing the curve, flattening the curve through social distancing does seem to be working, it is important to remember not to shorten it too soon. Just like last time I talked about, there's a risk of having a second spike of infections, which is something that we have seen actually. Apparently, so Hong Kong's overall numbers have gone down through rigorous social distancing and quarantining and tracking of infected individuals. These strict protocols have kept their numbers well under control, and since they've gotten better, they started to relax them. Well, what they've seen is that unfortunately some of the numbers have started to climb back up again. Now, one reason for this is possibly because since they opened their borders, more Hong Kong residents are returning from overseas, and they probably couldn't have been able to get back into the country for a while, and they may be bringing back with them new waves of the virus. So that's a possible confounding factor, but as a result of that, Hong Kong is now pulling back on some of its easing of restrictions. They specifically are closing some of their museums, since these are areas with high concentrations of people from a wide area. So one of my takeaways from that is that even though the Bay Area and California do seem to be doing better, it is possible that the way we will deal with this for the next few months is with kind of an expansion and contraction of restrictions as necessary. That maybe will, when things slow down a little bit more, will open up, like restaurants and small businesses. My prediction is that large gatherings, like large sporting events and concerts, might be closed throughout the summer, which is kind of a bummer for me for sporting events, but I really don't like concerts. Unless it's your band, then I love concerts. But none of this is specifically set in as a plan so far. This is just some thoughts about what may occur in the coming weeks and months. So, social distance seems to be working, but remember, that's not our only weapon in this battle so far. Vaccines are hopefully an option, but again, they will probably be at least a year out once they've been tested properly and the productions of scales ramp up. But there's a lot of other things that people are hopeful about that may also help us deal with managing this disease for the upcoming next few months in a more positive and socially reinforcing way. So first off, this is another figure by the same illustrator who did those animated social distancing curves that I showed last time. She gives a really good visual about how small social distancing choices can make have large effects. As you can see, what this shows is one person transmitting to multiple people and so on and so forth, giving you that exponential population curve, but a few individuals making simple choices to avoid certain situations, order something delivery instead of going out to the grocery store, so on and so forth. That can have huge effects downstream that helps overall slow that population spread. So looking again at this figure, this animated figure illustrating the difference between letting the disease just run its course rampantly versus enacting some of these social distancing and other procedures. The main concern in this is trying to get that curve below the carrying capacity of the healthcare system. Obviously, another thing that we can do to help deal with this situation is to raise that carrying capacity. And there are quite a few efforts underway to do that in many areas. So first off, one of the main limiting factors of hospitals is the number of beds. You may have seen online or on the news videos of places in Spain, in Italy, and even back in China where a lot of people were simply or are sleeping in the hallways of hospitals because there's no place to put them. And obviously it's going to be a lot harder to recover from a disease if you're lying on a cold linoleum floor. So there's a lot of places that are trying to set up temporary camps to deal with the spread of this disease, to try to give a little bit more structured support, especially for those who need medium levels of support and they just need a bed and a place for a medical professional to check on them. These temporary bed structures and hospital expansions are already underway. There's also a huge continuing concern of keeping available supplies on hand so that medical providers can keep safe and do what they need to do to help treat all of their patients equally. And there's actually been a very impressive effort from a lot of stateside companies such as Ford, 3M, and General Electric to, much like World War II, jump into the fight to try to create a lot of equipment that's necessary. Everything that's simple, from the N95 masks produced by 3M to the ventilators, the ventilator machines being produced by Ford and General Electric. These ones are one of the most critical tools that will be necessary for those who are in critical respiratory failure of the disease. Because remember that the number of people who survive it some of the people who survive it only do so because of advanced medical care. So increasing the availability of advanced medical care will increase the survivability, which again will raise that overall carrying capacity of the hospitals and help maintain the communities. But as a biologist, one of the things that I'm most interested in is the internal tool developments. Obviously, as I mentioned, vaccines are a little ways out, but there's a lot of people working on alternate, not so much cures, but therapies to help people deal with the virus more effectively. We currently have some therapies that help us treat diseases such as influenza, but not all of them are tailored to deal with this specific type of virus. So there's a lot of labs out there that are working on different methods of attack, some of them looking at ways that specifically block the genetic transcription of this specific virus, trying to stop it from reproducing when it's in the cell, trying to stop the cell from processing the RNA of the virus in order to make the viral proteins. Basically, the ways to stop the cell from packaging the virus, which involves the Golgi apparatus, which is my favorite organelle. Basically, just a lot of different ways that look specifically at how the virus works inside the cell and just trying different things to try to stop this virus. Again, these aren't necessarily cures, but they do help lower viral counts and allow the body to fight off the infection on its own without having a huge runaway chain of side effects that might damage the lungs and lead to pneumonia. And these are the sorts of things that even if we have a high number of people who are infected, if we have more efficient therapies, then fewer of them will be needing severe and critical care. More of them may be able to just deal with it at home, which again will lower the pressure on our hospital and intense medical systems. But one of the most powerful weapons in this battle is, as always, information. And so, as well as trying to test for new people who may be carrying the virus without having symptoms to get a better sense of who has it, one thing I'm really excited about is antibody tests, which will give us a better sense of who may have had it and have already recovered. Because if we can tell who is already recovered from the virus, that will give us a sense of who may already be immune. And once we have a sense of who's immune, then we'll know what the herd immunity of the community is. Now, basically, what herd immunity is in a population, there's a number of individuals who may be resistant to a certain disease, that even if there are others who aren't, the fact that there are enough that are keeps it from spreading around. A way to think about it is if you have like a pool table and you hit your cue ball and it bounces around all the balls and they're bouncing around, that's like an unprotected population. But if you start putting a bunch of bricks in the pool table and hit the cue ball, well, the balls may still bounce around, but they won't travel as far. They may kind of like stop up in areas and not, spread all over the place. So by trying to figure out who the immune people are, they're basically just giving you a sense of how many bricks are on the table to slow the spread of it. Now, people can obviously get immunity by having the disease and surviving it, but they also get immunity from vaccines. And that's why for other diseases, such as measles, which is extremely contagious, that's why it's really important to get vaccinated, because that brings up the herd immunity for the population and helps keep even possible random mutations from spreading around as much as they would, because there's just nobody that they can jump to if enough people are blocking it and resistant to it. And one of the numbers I've read for coronavirus in particular, or for COVID-19 in particular, is that if we have a herd immunity of around 60% is the estimate, so about 60% of people have already had it and are immune to it, then that may be a functional herd immunity, and we can start to roll out normal interactions once again. And then that will be even better once we get the actual vaccine. But we can't tell, again, how many people might be immune until we can test for it specifically. So the last thing I want to talk about here is something less easy to quantify, but is probably the most important statistic of all, and that is the importance of human resilience. So a few years ago, I read the book A Paradise Built in Hell by Rebecca Solnit. It's really interesting analysis of human communities' responses to disasters, from the San Francisco earthquake and fire to 9/11 in New York City, to Katrina in New Orleans and Louisiana. And what Solnit found is basically all of these stories, and this is a blurb from the back of the book, all of these stories that taken together shows that, quote, the typical response to calamity is spontaneous altruism, self-organization and mutual aid, with neighbors and strangers calmly rescuing, feeding, and housing each other. So as this situation has continued to evolve, and is obviously the most major thing to happen to this country and the planet in a long time, one of my concerns has been, how can human communities come together to try to overcome this when we literally can't come together? Like, how do you do the same sorts of things that San Franciscans did after the earthquake, or that New Orleans residents did after Katrina? But what I've been seeing just in terms of my daily lives has shown that humans will find a way. Walking around my neighborhood, I've seen flyers up on poles offering for people who need help with grocery services, whether they are, an older person who are too afraid to go to the grocery store, or are busy dealing with kids. People just offering help and assistance. Some of the little neighborhood mini libraries that people give away free books, they're now giving away free food and toilet paper to whoever needs it. Online, the website Nextdoor, which is usually a hive of scum and villainy and let me speak to your manager haircuts. There's been tons of people posting on there just trying to connect with each other and help each other as best as we can without actually, being able to interact face to face. Obviously, people are finding all sorts of digital tools to connect, both in terms of, functioning for our jobs and our education, but, finding ways to connect with each other on a relationship level. I hope my mom gets set up on FaceTime for the first time ever, just so that I can see her face and talk to her, especially because tomorrow's her birthday, and normally we'd be able to go to lunch or something, but I'm not going to be able to. But something like this is trying to find a way around the situation to still make these connections. So one of the lessons that I hope that people take from this is that, and this is something that I bring up in my classes too, is that humans always are, have always been, and always will be each other's best hopes for survival. Always. And we know this. We know this on a literal genetic level. That there's study after study that shows that these basic behaviors of altruism and helping each other, they start off in babies, and they are baked in to our human experience. And trusting and building communities with each other, it's encoded into our genes, it's encoded into our laws, it's encoded into our religions, and it's encoded into our stories, because it is literally what makes us human. And in all of this, I'm really proud of the way that science specifically has demonstrating this, in terms of how we have labs from around the planet that are openly sharing data, sharing resources, sharing chemicals and reagents on a local level, just doing whatever we can to work together in a big scientific system to deal with this. Really proud of the way communities have been working together to manage resources and try to find solutions to the best of our abilities. And I'm really proud of how individuals have been working together to find ways to connect, even as we have to stay apart. So as well as continuing to maintain social distancing, one of the things that I encourage you to do is, first off, take care of your own health needs. And this includes your physical health and your mental health, that both of these need to be in top shape in order for you to function to the best of your ability. But once you've done that, if you find yourself just at a loss for what to do and how can you move forward in all of this, I suggest to you to think, the first thing you should do is think, what can I do for somebody else? What can you do to help people in your household, people in your neighborhood, people online, reaching out to people that you haven't talked to in a while, making sure they're okay. Whatever it is, just finding some way to help somebody else will feel right to you. And hopefully from there, you will feel more grounded to continue to move forward in other areas as well. And it feels right to help other people, because that is who you are. That is what humanity is. And even if we're losing everything else that feels normal around us, that is the one normal that we can always come back to. So thank you for watching and listening. Thank you for continuing to learn and being adaptable as things keep evolving. I will certainly try to share as much as I can. For those of you in my classes, please look out for my posted office hours on Zoom. We can talk more about this directly. Take care of yourself, take care of each other, wash your hands.